it's such a complex world that we're living in. And I agree things are going to just change at a rate of knots. But I also just want to call out the HIV community, I think, is an exemplar in terms of how the communities work together. In terms of vaccines, I agree it is probably more homogenous in terms of how we access vaccines and how we access information. And I think it's not just about accessing information, it's accessing healthcare itself. So it's not traditionally just going to see your GP. There's a lot more already happening virtually, but again, there's nothing uniform. There's a real postcode lottery within a country, let alone the globe. But if I think about vaccines and what gets the shot in the arm, to reference this podcast, it takes an army and a huge amount of time. Not only, if you think holistically, we've got to have the funding, the recommendations, the access, but then you've got to ensure that you have a consumer, for want of a better terminology, at the end who has got the information to make that decision. And now to have so much noise from them from all over the internet, they also need to trust their doctor. So we need to make sure that their doctors are fully informed, and not only that they have checked their own beliefs and feeling confident in what they're sharing with their patient, but they've got to believe in it as well. It's very difficult for an HCP to recommend something that they don't necessarily believe in. And I think that's the world we live in. So from an industry perspective, I think it's imperative that we can be seen as a trusted source of information, but we cannot be a trusted source on our own.